Good morning, everybody. Yesterday, New South Wales had 148,000 people who came forward to get vaccinated. Another huge day, and a day we're deeply grateful for. It's really assisting us in getting to that 70% double dose figure sooner than we had anticipated. So that's fantastic news. We also had over 170,000 people come forward for testing. So huge numbers coming out to get the jab and also to get tested. We had 1,116 cases of community transmission in the last 24 hours to 8 p.m. and regrettably 4 people lost their lives with COVID, and we extend our deepest sympathies and condolences to their families. 4 females who unfortunately weren't vaccinated and who did have underlying health conditions. A woman in her 50s, one in their 60s, one in their 70s and one in their 80s, and again we extend our deepest condolences to their loved ones. It's very pleasing to note that New South Wales is demonstrating our capacity for record vaccination rates, leading the nation. And I just want to remind everybody that September is the month when we're asking everybody to get ready. Get vaccinated if you're an individual, and if you're a business, start dusting off your COVID safety plan. Make sure that your employees are vaccinated so that we can get back to life at 70% double dose vaccination, which we anticipate will happen somewhere around the middle of October. And that's certainly the date we're working towards. Initially it was the end of October, but because everybody's coming forward at the rates we're seeing people come forward, that could be as early as the middle of October. And when we hit the 80% double dose number, which we anticipate will be in November, New South Wales looks forward to having our citizens enjoy international travel. And also, New South Wales looks forward to stepping up and welcoming thousands of Australians home who've been waiting to come home for a long time. And as I've also said, once you hit that 70% double dose number, hotel quarantine looks very different, quarantine looks very different, the way we manage the disease is very different, the way that we manage tracking and tracing is very different. And I'm having these conversations now with everybody so we can get used to what life is like in living with COVID. And again, I restate our position, which we stated from the outset. It is impossible to eliminate the Delta strain. New South Wales has proved very successful until this point in time in getting rid of other strains of COVID, but the Delta strain is a game changer. And every state in Australia, sooner or later, is going to have to live with Delta. And that's why I'm calling on all my colleagues, all other state premiers and first ministers to stick to our plan, stick to the national plan, to make sure we give our citizens not only the freedoms they deserve, but also learning to live with COVID as soon as we can. I'm also very pleased to have with us today Dr. Ahmed Al-Rabai from Bankstown Hospital. He's a specialist there, and he has been working very hard to convince many of our members in the community that the vaccines are safe. Are the vaccines safe? And he'll speak about his experiences and all the great community work that's been going on to encourage all of our citizens to come forward and get vaccinated. Dr. Gow will now give the public health update. Deputy Premier will deal with rural and regional issues, and then we will take your questions. Thank you.
Thank you, Premier, and good morning, everybody. Till 8 p.m. last night, there were 1,116 locally acquired cases of COVID-19 reported in New South Wales, and there were also 2 overseas cases. Again, the people of New South Wales came out in record numbers to be tested, and a big thank you again for people for doing so. There were 173,913 tests reported till 8 p.m. last night. In hospital at the moment, we have 917 COVID cases admitted. There are 150 people in intensive care, 66 of whom require ventilation. As we've seen to date, the majority of those people in ICU have not been vaccinated, and of those 150, 127 people in ICU are not vaccinated. As the Premier said, sadly, we report the deaths of 4 people today. They are a woman in her 80s from southwestern Sydney who passed away at Royal Prince Alfred Hospital. She was not vaccinated and also had some significant underlying health conditions. We also report the death of a woman in her 60s from Western Sydney who died at Concord Hospital. She was also not vaccinated and also had underlying medical conditions. A woman in her 50s passed away. She was from southwestern Sydney and died at Liverpool Hospital. She was not vaccinated and also had some significant underlying health conditions. A woman in her 70s passed away from southwest Sydney, also at Liverpool Hospital. She was not vaccinated and also had underlying health conditions. And on behalf of New South Wales Health, I extend my deepest sympathies to the families of those 4 ladies who have sadly passed away. Of concern today is that we have had sewage detections in quite a number of locations across New South Wales, and we do encourage residents of those areas to please come forward for testing. And those areas are in the Murrumbidgee LHD in Temora, in southern New South Wales area of Thredbo and Merimbula, in mid-north coast in Port Macquarie, Dunbogan, Bonny Hills, western New South Wales, the people of Warren and Molong, and in Hunter, New England, Tamworth and Gunnedah. So if you live in any of those areas, please come forward for testing. We're currently unaware of any COVID positive people in that area that might explain the sewage detection, so please come forward for testing. And finally, I'd just like to again call out those suburbs in the Greater Sydney area where we continue to see the highest number of cases, and again emphasise our request to people living in those areas to please take up every opportunity for vaccination. Please follow the stay-home orders like everyone else in New South Wales, and please come forward for testing. And those suburbs are Guildford, Georges Hall, Marylands, Auburn, Punchbowl, Bankstown, Lakemba, Yagoona and South Granville. Thank you.
Good morning, and can I start by offering my condolences again to those families that lost loved ones. You remain in our thoughts and prayers. Overnight, to 8 p.m. last night, we've had again a continued number of cases in regional and rural New South Wales. In the far west, 3 new cases in Wilcannia, which again leaves us with concern. And speaking of Wilcannia, we know over the past few days with the increased cases, we have had an issue around accommodation, but the ability to isolate individuals. New South Wales Health has procured 30 motorhomes, which will be set up at the local council-run camper van site. It'll have access to power and water and, of course, waste disposal. And this has been already communicated with the community and embraced by the community, and that'll start next Monday. So an opportunity to really to put an extra effort into Wilcannia. Again, for those residents of Wilcannia, please come out and get tested. In Western New South Wales, numbers were down from yesterday, 29 cases, predominantly all in Dubbo, 18 cases in Dubbo. Then there was 3 in Burke, 2 in Blaney, 2 in Narromine, and Bathurst, Mudgee, Orange and Walgett all have had a case each. In the Hunter region, 6 new cases, 4 were in the Lake Macquarie local government area and 2 from Newcastle. On the Central Coast, again 2 more cases overnight. They were linked to previous cases. And Illawarra, again 8 cases overnight, 6 in the Wollongong local government area, 1 in the Shell Harbour local government area, and 1 location is still under investigation. That'll be confirmed later today. Southern New South Wales, there were no cases. Can I also put a call out to the community of Wilcannia? What we've seen in the Central Darling local government area is a significant increase in vaccination, and in just under a week an increase of about 11% across the board. That includes places like Wilcannia, where now we have 67% single dose and 39.2% double dose vaccination for that community, which is a mighty effort from where we started from. But my call out to those communities is to continue to get vaccinated. And on a further message about vaccination of the people of Broken Hill, we know there are cases, we know the proximity to Wilcannia and some hotspots. We are encouraging people not only to come out and get tested if there are early signs, but most importantly is to improve those vaccination rates. So again, a call out to regional rural New South Wales, get vaccinated. Thank you.
Good morning. My name is Dr. Ahmed Aroubi. I'm an associate professor at the University of New South Wales and a gastroenterologist and therapeutic endoscopist. I work at Bankstown Lidcombe Hospital, but I am here as a representative of our communities in West Sydney and South West Sydney. Our communities in Bankstown, Canterbury, Fairfield, Liverpool and Campbelltown have been hit hard by COVID-19. These areas are virtually the epicenter of this wave in New South Wales. I have been one of many community leaders, organizations and individuals who have been working hard to keep our community safe. Our communities in these areas are responding well to the calls to get vaccinated and staying home. We have a progressive increase in the rate of vaccination, particularly over the last 6 weeks, with more than 66%. These are data from 2 days. 66% having the first dose and more than 30% having both doses together. We have this in spite of we still have some of our people in our communities confused by the misinformation which is circulating through the social media and through their social networking. This misinformation was including every single aspect of vaccination early in the process of rollout, including the contents, the ingredients, all the myth about these contents, including the short period of production. But currently, the focus of this misinformation is on the safety profile, on the side effect of the vaccination, and to a lesser extent on their efficacy. And as a result, we still have some people hesitant about getting the vaccination. To those people, I say, COVID-19 vaccination are safe and effective. This is not only our experience here in Australia, it's the experience of the world and all developed countries. Up until 3 days ago, there were 5.2 billion doses given worldwide. And we have a lot of data from all this number about the safety of the vaccines and the very low narrowed profile of the serious side effects of these vaccines. COVID-19 vaccines are effective and they are the best available protection against the virus. They are effective in reducing the chances of catching the virus. They are even more importantly effective in preventing the serious forms of the disease. They are effective in keeping you away from hospitals, intensive care units, and from death. By vaccination, you protect not only yourself, but your kids, your families, your friends, and your contacts. My message is also to our young men and women. Delta variant of the vaccine is much more infectious than the original version. And we see more and more of young, healthy and fit people and even children having the disease, are infected. Delta virus can cause more serious features and disease in young and healthy people. And all of us knows that the number of young people, less than 40, in the ICU are increasing. Long COVID can have a bad impact on your learning and study. And this can continue even after the full recovery from the disease. Don't listen to any social media. Don't listen to any YouTube. Don't listen to any WhatsApp networking among you guys. The only reliable source and trusted source is the information from the health authorities, from health professionals, and from sites you can get, including the nsw.gov.au. Talk to your GP. Talk to your specialist if you have any concern about the vaccine. Our communities in general are tired, and many are concerned. But we are strong, we are resilient, and we are confident that we will get through this. I think the fight against this deadly virus is the responsibility of every single person of us. It is your responsibility also. By first, get vaccinated without any delay. See your GP, see your pharmacist, and visit the nsw.gov.au for an appointment. Get tested with the minimal symptoms in our areas, because there are still hotspots, or even without symptoms if you think you are a contact, close contact, or a casual contact. The test is very simple. It takes a few minutes. It's free, and it's available everywhere in our areas, but it has a very important role in early detection of cases, and early diagnosis, early treatment, and in localizing cases and in tracing contacts. So please get tested. Don't visit others, and don't accept visitors in your household for their safety and for your safety. Stay home unless for essential work. Thank you.
You said even more adamant today.
70% double dose. You can expect to do everything that you missed doing. Please expect to do all those things we've been missing for too long. Is that a promise, first of all? And does that apply, because a lot of people will be watching from the hotspots, does that apply across the board in New South Wales? And everything, does that mean everything? Home gatherings, cinemas, sporting events, outdoor pubs and clubs, everything?
Obviously, New South Wales always takes a responsible approach, but the national plan does say at 70% double dose vaccination that you can expect to go out and have a meal, you can expect to attend a public event, you can expect to go and get services that you can't expect to have done now. But obviously we'll take a very responsible approach, and we know what the high risk areas are. Indoor gatherings or people coming to your home are high risk. But outside of that, if there are many things we can't do now, we should expect to be able to do them when we have 70% of our adult population double vaccinated. That's the national plan. That's what the national plan says. I'm not saying any differently, anything that every other state hasn't signed up to. And obviously that increases once you get to 80%. Of course, at 70%, there will be density requirements in relation to venues. There'll be QR code check-ins, validation that you're vaccinated, mask wearing in certain settings. So there will be obviously constraints and some restrictions in place. But compared to what we're going through now, life will be much better at 70% double dose than what it is now. And that's why I'm really calling out to businesses to say, let's have September the month we all get ready. If you're an individual, get vaccinated, get your loved ones vaccinated. And if you're a business, dust off those COVID safety plans and get ready to reopen your doors.
You've also said,
Excuse me, Premier, hotspot LGAs, will people, if they're fully vaccinated in the LGAs of concern, be able to look forward to the same freedoms that other people who are vaccinated will get at 70% double dose?
Well, clearly we've had a concentrated effort to vaccinating our population in those local government areas of concern, and the vaccination rates not only have come up from a very low base, but now a lot of those areas have far higher vaccination rates than other parts of Sydney or New South Wales. And as we've said, the key issue for us moving forward is the rate of vaccination and how many people you can keep out of our intensive care wards and hospitals, and they're the figures that matter the most. So everybody should expect a level of freedom which they don't have today. And in relation to those settings, we're going through the roadmap, we're getting the health advice. It will also depend obviously on a number of other factors, but no matter, let me be very clear, no matter where you live in New South Wales, please expect to have much more freedom than what you do now, so long as you're vaccinated fully and so long as 70% of our residents are vaccinated, and details of that will be provided in the next little while. So,
on the hotspots, will it be equal freedoms? Will hotspots get equal freedoms to people that aren't in hotspots?
well, look, we're obviously looking at all those issues, but I do want to say to every citizen, no matter where you live, life will be much better much freer, so long as you're vaccinated at 70%. We'll provide details as soon as we can. We're obviously taking input from stakeholders, from our health experts, and also comparing it to the national plan, which has already been released. So the national plan is on the public record, and New South Wales would be adhering to that national plan. And obviously we're really keen to see our nation move forward, but we also appreciate that what is the most critical numbers for us to keep a very close eye on is the rate of hospitalisation and the rate of vaccination, because at 70% double dose and 80% double dose, life will be very different and life will be much better than what it is today.
You've said in the past that October is going to be our most challenging month for our hospitals. There's modelling. Why can't, Lucy asked this yesterday, why can't you disclose that modelling, the worst case scenario, the best case scenario, so that we as citizens can make a judgment about whether that's correct?
Well, the best judgment is what the public health experts are telling us, and every day the modelling changes. Every day there's inputs put into the modelling, and every day there's different models around. There's many institutes across the nation that will provide input into what New South Wales looks like, but that's depending on a number of variables, and we shouldn't be in the habit of providing information which is not certain, because it depends on the inputs, it depends on the rate of vaccination, it depends on what people are doing, it depends on compliance. There's a whole range of issues that go into that. But what we do know, because of the best test case is the accumulation of case numbers, we know that there is always a lag between when someone gets ill and when they end up in hospital, and we anticipate, given where the case numbers are and given the rate of vaccination, that the highest rate of hospitalisation will occur at some stage in October. As soon as we see anything more certain than that, of course, we'll provide that information. But
it suggests cases could peak at 2,500.
well, there's been modelling put on the public data, which has many ranges, and we've. I've seen various versions of modelling, and I can't recall what all the numbers are, but I can tell you this much, that we know that the rate of hospitalisation is likely to peak sometime in October. We know there's ranges of predictions on what the case numbers will come up to. I've often said, as Dr. Chant and Dr. Gall and others have said, we anticipate the worst will be in the next couple of weeks in terms of case numbers, and that is because the worst will be in the next couple of weeks, because the impact of the vaccinations takes about 2 or 3 weeks. And as we've said from the outset, lockdowns work in suppressing the spread of the virus, but the best antidote, the best weapon in fighting the virus is the vaccine. And once we know someone is vaccinated, it takes effect in 2 or 3 weeks' time. And we know there's been a high concentration of vaccines administered in the last week and the upcoming 2 weeks. So it follows suit that we still anticipate case numbers to rise in the next couple of weeks, and then we anticipate and hope that they will start to come down. Ursula's turn, sorry.
You can't recall.
I'm sorry, it's Ursula's turn, yeah.
Well, I do have a question, but I will actually just let Alex finish that.
Okay, sure.
Just to follow up there, you can't recall what the worst case scenario peak that you've been presented with is.
Well, no, I'm saying there's various modelling that is done. New South Wales Health provides us with modelling, but there's also modelling done by external organisations, which New South Wales Health isn't part of. And those external organisations, as we've all publicly read, have varying degrees.
Advice to you from New South Wales Health. The worst case scenario they presented to you, you don't recall what that is.
Look, the worst case scenario varies, and it varies, and it depends on what the inputs might be. And I wish I had a crystal ball to be able to tell you. What I can tell you, the most recent advice that I have received is that case numbers are likely to continue to rise for the next few weeks, and the worst hospitalisation rate is likely to be in October. And I can't tell you any more than that, because that is the best advice that I have.
Just on those restrictions, just back, so everything is on the table at 70%. Stadiums open, you said this morning on Sunrise, so stadiums will be open, home visits are on the table, cinemas are on the table.
Well, obviously, things like, as I said, high risk issues like home visits is what the greatest risk is. And what is key is for us to be able to demonstrate that people are vaccinated. So when you have a controlled environment like a venue or an outdoor event that's ticketed, you can actually control that only vaccinated people come through. And that is the key. The 70% freedoms relate directly to full vaccination. And that is why it is key for us to be able to demonstrate that people are fully vaccinated when they're attending an event or attending a venue. And clearly, for all of us, indoor is more high risk than outdoor. But having said that, controlled, regulated environments are safer than uncontrolled environments like homes. So it would be far safer, for example, for a family to have a meal in a restaurant than it would be necessarily to have people come into their home that may or may not be vaccinated. So the key to freedoms is the full vaccination, is someone being fully vaccinated and being able to demonstrate that. And that is what we're basing our roadmap on, and that is what we'll obviously convey to the community as soon as we finalise those plans. And I'm hoping it won't be too long before we can do that, but it will reflect very closely the national plan that the Prime Minister and all the state leaders have been discussing. So it won't diverge from the national plan, but it will be our commitment to stay true to that. Clearly, for example, in some states, they may have 2 square metre rules depending on their number of cases. In New South Wales, we might start with 4 square metre rules. So I put that on the table, that they're the type of issues that we'll consider closer to that time, and obviously with the best health advice. And similar to our plan for schools, that we obviously took the health advice, took education advice, and then made decisions. And this will be a similar approach. Stakeholders are coming forward with their suggestions, and the health advice is critical, but every state can assess its own risk at 70% double dose, and I'm sure some states will continue the way they are, but states like New South Wales and Victoria will need to look more closely at what the case numbers are doing at that time. And I anticipate density may be, for example, an issue which differs from state to 70%, but I'd much rather know that I can go to a venue and have a meal or have a drink or get a service that I can't get now than not, and that's the strong message we want to send to the community.
You seem more adamant today in your rhetoric that of the prospect of international travel when we do reach 80%. So why now have you decided to halve the international arrivals cap?
Oh, that is only a temporary issue for the next month. We know at the moment, this is the irony. For example, Dr. Gale read out today, I think, 2 overseas cases. So we have 2 overseas cases where thousands and thousands of staff are looking after 2 cases with COVID versus the number of cases we have in the community. So as a pause in the next month, we've halved our travel. Every state, most states have. I think Victoria for a long time didn't take anybody. We're still taking more than any other state, is my understanding. But having said that, once we get through September and October, which are the months we're most worried about, and once we get to 80% double dose, I want New South Wales to lead the way. If Australians come home through Sydney Airport, I welcome that. Once we get to 80% double dose and we have a different quarantine system, one that involves home quarantine, for example, for returning Australians that are fully vaccinated, one that has a different system which is less reliant on health staff and police staff, we can then put those resources elsewhere. And I would welcome Australians coming home through Sydney Airport, because once you have 80% of your adult population fully vaccinated, once you're welcoming home Aussies that are fully vaccinated, you have a different quarantine system. And that's why I'd like all of us to think about what life will look like at 70 and 80% double dose. And this is one other key, really important measure. I'm confident, without a doubt, that we'll get to 70% single dose in the next few days. So we know for a fact that 70% of our population, once you've signed up for the first dose, you're going to get the second one. So that gives me confidence we're going to hit a 70% target. But what is the greater challenge is to make sure we get first doses to 80% as soon as we can, because once we know first doses have hit 80%, those people, those citizens have signed up for the second dose. And that gives us, there's not a lot of, I think the only 2 places on the planet are Malta and Singapore that have 80% double dose vaccination. And that's certainly a target we need to get to allow for international travel.
Can I just pick you up on international travel?
Who hasn't asked a question, Peter?
Personal testing kits are now quite common in the UK. Is that something you're considering here, that people could test themselves at home and not even leave home if they've got a positive result?
Well, that's obviously part of the things we're looking at, and it's certainly part of the national plan that rapid antigen testing can have a different role than what it does now. that you won't have the standard test. I mean, Victoria has had, I think, 40,000 tests in the last 24 hours. We've had 178,000 of the old test types. So you can imagine the stress on the system when 178,000, and we're not complaining, we're grateful that so many people are coming forward. But you can imagine in a world when 80% of your population is vaccinated, double vaccinated, or even 70-something% of your adult population is fully vaccinated, that does give you options on what tracking and tracing looks like. It's very different to what it looks like now, because at the moment, we obviously still have a large proportion of our population not vaccinated. But once the majority, a healthy majority of the adult population is vaccinated, you think very differently about how you test, about how you quarantine, about how you isolate. Things will be very different come 70% and 80%. But my biggest... It's possible that you will self-manage that in the future. I mean, I'm not excluding it, but I'm certainly saying it's on the table. You will manage that, and also some venues might choose to do that. Workplaces, for example, who have very sensitive equipment or very sensitive infrastructure might not just rely on their workers being vaccinated. They might also want or have rapid antigen testing. So these are all issues that will be dealt with in the next little while, but they're good conversations to have. They're better conversations to have than if the vaccine take-up wasn't where it is. And this is why we do need to change the way we think about the disease. We need to change the way we think about how we treat the disease, but also how we live our lives getting to those milestones. And there's a couple of things that really worry me, and that is, every time there's someone in intensive care, you can only imagine what having COVID in a serious way is like. I mean, none of us can unless we're in that situation, and we want to avoid heartbreak. We want to avoid people going through this horrible, horrible experience, and we know vaccination is key to that, and we just ask people to consider that. And obviously, we always have to have a keen eye on the rate of our intensive care beds and capacity. We have surge capacity, we have capacity for much more than what we're taking care of at the moment. But we don't want to put additional pressure on an already stretched system, and we want to make sure that we always manage the number of people in intensive care. And that's why for some states, when they get to 70%, for example, 70% double dose, they might choose to have full stadiums, they might choose to have no density requirements. Where in the case of New South Wales, we're likely to have density requirements and also other capacity constraints, given where the case numbers will be at. But having said that, the key is if you're fully vaccinated, you'll be able to do a lot more than what you can today. Life will be very different, and life will be starting to get back to normal. And at 80% double dose, we can look forward to international travel. We can look forward to all those things we've missed out on for nearly 2 years.
Can New South Wales residents expect to be able to freely travel interstate in November with that 80% vax target, and that states lose their ability to shut borders at that target? Oh, well, look, I definitely hope that's the case, because we all signed up to the national plan. We all signed up to the plan which had its research based on the Doherty Institute, and that's really important. And I also again say that as confronting as this is, a lot of states who haven't had any major outbreaks during the pandemic are going to have to appreciate that once you get to 80% double dose vaccination and you open your borders, Delta will creep in. But if your population is protected and you've got COVID safety plans in place, good QR code system, good systems to monitor where the disease is circulating and warn residents, take immediate action to take care of outbreaks that may or may not occur, well, that's the way we have to live with COVID. And as confronting as that is the reality. And I hope that every Premier is signed up to the plan, and I hope we all stick to the plan. But all the conversations that I've had with the Prime Minister suggest that the nation will continue to move forward, and I feel that Victoria is perhaps turning the corner in how they're dealing with COVID in terms of accepting what the Delta strain is like and what it means for citizens. And I hope that we're in a position at least where the two largest states are on the same page in how we move our nation forward. Between the two of us, I think it's 65 or 60% of the nation's population. So between the two of us, if we're on the same page, I'm sure other states will get on board as well.
What does it mean for New South Wales, though, if none of the other states get on board with the way that you're aiming to do things in New South Wales? What does that mean?
Well, what we're doing in New South Wales is entirely consistent with the national plan that all of us have signed up to. So I guess I'll just say to the other premiers, we all signed up to it. Every single premier in the state, every chief minister signed up to the plan. And all I'm doing is working towards the plan, as I hope every other state premier is. But the only thing I will say from experience here in New South Wales is that every state at some stage, and if not at 80% double dose, then when, every state is going to have to accept that you can't live in a bubble forever. Your citizens will want to travel interstate, your businesses will want to grow interstate, your citizens will want to go overseas, your citizens will want to come back from overseas. So if not at 80% double dose, which is what our national plan says, then when?
Health workers, it's now mandatory, they've got a month to get to 100% first dose. Are you confident that you'll meet that target, that all health workers will come forward? And what happens if that doesn't happen?
Well, look, I'm confident we'll get very close to that target. I think from this morning we were just looking at some figures where between 76 to 83% of all health workers were already vaccinated. So the numbers are very high, but you always have new people coming into the system, and it's important to make sure those new people coming into the system are vaccinated. And of course, we're still catching up on vaccinating aged care workers and other cohorts who haven't yet been vaccinated. So I'm confident that by the end of September, we will see those rates of vaccination go up. Obviously, for health workers, the rate of vaccination is much higher than the state average, much higher than the national average, in fact. So I'm confident that I think that the most recent figure I saw was around 83%. I'm not sure whether or not that included aged care workers, but certainly I'm confident that number will allow us to move forward. And various settings are already, we're asking people to be vaccinated before they go back to work, whether it's teachers or construction workers, and that is the way of the future, and that is part of our way of living safely with COVID. So I'll do the follow-up, yep.
Have you had any discussions of what will happen if you don't meet that 100%? Will you move people out of the system? They won't be able to work in hospitals, anything like that?
Oh, well, look, Minister Hazzard is working with all the stakeholders, and I know that he was very grateful that many representatives, including many unions, were very proactive and very enthusiastic is perhaps a strong word, but very positive about the need to vaccinate and protect workers as much as patients they're looking after, but also the families of workers. And that's certainly issues that we're working towards. It's always difficult when you move down the path of trying to get everybody who works in the health system or in a large system, when we rely on people every day, to do something in a compulsory way. But I think everybody understands. We've seen through this outbreak that unfortunately too many people have died in a health setting, or I should say too many people have acquired the virus in a health setting, and we don't want to see that continue. And certainly we want to be fair to the workers, but also accommodating along the way, but also accept that if you look at the statistics, too many people acquired COVID whilst in a healthcare setting, and we don't want to see that trend continue, and that's the balance we need to strike.
The mayors in the hotspot zones.
I'm sorry? Yep.
The mayors in the hotspot zones say that they asked to sit down with you to get their roadmap out. They're obviously under very tight restrictions. Some of those restrictions have been in for 2 weeks and aren't showing any signs that they're decreasing cases. So firstly, why keep the two-tiered restrictions in place on those hotspot zones? And secondly, why did you not sit down with them for the roadmap out?
Firstly, the roadmap is still a work in progress, so please know for all stakeholders you'll be involved in the process, and we've started the process off and we'll obviously continue the process in the next little while. In relation to restrictions, I remember it was only this time last week I was still getting criticised for not being too hard, not being hard enough on restrictions. So it's always a challenge, with all due respect. Many of you were asking me why we weren't going harder and stronger and faster. Well, it's always a balance. It's always a balance of getting the restrictions where they need to be, and we're definitely in the stage now of welcoming those higher rates of vaccination and seeing how we can ease the burden on our citizens, definitely. And already we've announced some easing from the 13th of September, which is now only 2 weeks away. But we are constantly asking the health experts to give us positive advice on what more we can do. We're looking very closely at the regions, looking very closely at the local government areas of concern, and welcoming the high rates of vaccination and seeing if there's any relief we can provide in the month of September. And without any hesitation, we will, as soon as we know it's safe to do so.
The mayors they're asking for, they're trying to work out how they can get out of the harshest lockdown setting. So Can you give them some guidance about that? And to further repeat that question, why haven't you set aside time to meet with them directly?
Oh, look, can I say that I would always welcome meeting with community leaders, and I've spoken virtually to hundreds and hundreds of them. On many of the conversations I've had, those local mayors have been directly involved. I'm not certain about the invitation they're talking about, but certainly there's been numerous occasions when I've engaged, the Minister for Health has engaged, our health officials and members of our other agencies have directly engaged with all the community leaders, and that is ongoing. That is ongoing. But please know that all the advice we get about what we can do in those areas is based on the health advice, and it's to keep people safe and healthy. And still, as Dr. Ahmed said so eloquently, there's still a proportion in the community, unfortunately, who don't appreciate how serious a disease COVID is, and we want to make sure that everybody's protected. But having said that, I am deeply grateful to the vast majority of our citizens across the state, no matter where they live, about how well they've responded to what we've asked them to do. And I will be the first one to provide relief as soon as we get the green light. We are definitely in that space.
Given what you've provided an email exchange today with your office, which the reply from your office said, I hope you'll appreciate that the Premier received a significant number of diary requests and that she is unable to accept them all. On this occasion, the Premier will be unable to accept your meeting request, and that was to Councillor Linda Scott on behalf of the hotspot LGA mayors.
Yeah, I think that request was from the Local Government Association, which is a peak body, whereas I would want to engage directly with those local community leaders, and I've already been doing that. And can I say that I've not advertised how many times I've spoken virtually to community leaders, but I've done it every day almost, and I'll continue to do that. And I want all the community leaders to know, no matter where they are, that we will engage with them, we will continue to listen to them, continue to seek their advice. Many community leaders, including mayors, have had direct input into our vaccination rollout strategy, into providing us feedback on what's happening, and we're deeply grateful for that. And I'm also deeply grateful to parliamentary colleagues who've put aside their politics and political differences to work with us. And I can't tell you how reassuring that is in order to allow us to move forward together.
Premier, can you give a guarantee that you will meet with the 12 mayors?
I've been meeting on an ongoing...
They want to meet all together as one, the 12 of them with you?
I've been meeting on an ongoing basis with many community leaders. I'll continue to do that, but I also want to make sure that I will deal with them directly, not through other parties.
Follow up on that. Sorry. Just quickly to follow up on that. These 12 mayors want to meet with you to talk about a roadmap to get out of the harshest restrictions. Will you do that? Yes or no?
Look, I've been doing it already, and I'm happy. I've been already talking on many occasions to community leaders, and that will be ongoing, of course. But there's more than just local government that's involved. There are community leaders who touch hundreds of thousands of people. So, of course, the mayors will be involved in that process, but so will our religious leaders. So will our cultural leaders. This is an ongoing, evolving process. And know that this is something we work on day and night every day. And what causes me the greatest stress every day, and I say this hand on heart, is what we're asking people to do in those areas of concern. It is onerous, it is difficult, it's stressful, and I'll be the first one to go the other way as soon as we get the green light. But I just say, to everybody, Delta is evolving, and the questions I'm getting today are very different to what I was getting just a few weeks ago when I was being accused of not being hard enough. So know that getting the balance is difficult, it's challenging, and that is always what causes me the greatest angst, because you don't want to burden your citizens unless you have to, but you also want to keep people alive. And that is the challenge we battle every day, something that wears heavily on me personally as well as the government. And any time we can provide relief, we will.
Premier, on September 13, we're going to get new freedoms in. These, people will be picnicking, but there's still been no talk about benefits for double vaccinated people to visit elderly in aged care facilities. When are you going to make a decision about when people in aged care facilities can receive visitors again?
Look, as soon as health says it's okay, of course we'll do that. So we're just taking our advice, and I I suspect it has to do with making sure there's evidence of full vaccination and also vaccination of workers, so all those issues, and health will give us that advice. I mean, we want to see, our whole aim during this has been to reunite people that haven't been able to see. I haven't seen my parents for more than 2 months. I'm sure many of you haven't seen your loved ones either. And this is a very difficult time, and we want to make sure that we provide those freedoms as soon as we can. But I know that people will not believe me when I say this, but we have done incredibly well to keep the case numbers where they are, given our population, given the spread. In fact, if you look at the trajectory of where Victoria's case numbers are going, you know, I'll let people make those comparisons themselves. But having been through this, we know how quickly case numbers get up to where we are now. And had we not taken the measures we had, they would have been much higher. But at this time, when we don't have the vaccination rates where they need to be, because 70% and 80% are the safest, we don't want people risking heartbreak. We don't want people ending up in ICU or dying. And we want everyone to be protected. So we're going through that process now. I always said September and October would be the most difficult months, and they will be. But also the best months in terms of the future.
Premier, can I just ask you?
Premier, am I able to ask you a non-COVID related question? Well, when you're at the end though, can I just
ask the Premier one, please? Premier, can I just ask you?
This is about COVID, I'm sorry.
Okay, Premier, can I just ask you?
Is New South Wales actively considering releasing up to 1,000 prisoners to reduce overcrowding with some health risk?
I'll ask Dr. Gale to talk about the prison system, if that's okay.
And also, Dr. Gale, what are you doing to reduce the spread to regional prisons if you can?
Sure. So I can't speak on behalf of corrections, but what I can say is that from a health perspective, clearly we are concerned about prisons as a setting for spread. We know that often we have vulnerable populations who are in prisons. We know the conditions in prisons often are conducive to the spread of communicable diseases generally. And there has been a lot of work done in the sector since the beginning of the pandemic to have plans to reduce the risk. And I know that Justice Health in particular has done a lot of work in planning to try and make our prisons as safe as they can be. There's been a lot of efforts in rolling out vaccination as well to prisons, both for staff and for people detained in prisons. Clearly at the moment we're concerned primarily around cases in the Parklea Correctional Centre. We now have a total of 80 cases in Parklea, and there were 5 new cases reported overnight. There are a total of 77 of those are inmates and 3 are staff members, and I think it's an example of the risk in our prison system. But there's a lot of work being done at the moment in Parklea to make sure that the infection control practices are robust, that staff have appropriate PPE, that vaccination is being rolled out with intensity. There was already pretty good vaccination coverage amongst staff and in Parklea, so there's a lot of effort going into that, but I think it does demonstrate the risk in the prison system and a lot of focus there across the state about managing and mitigating those risks.
Does that include releasing prisoners though? Is that on the cards?
I can't speak to that from a health perspective, but certainly from in terms of reducing public health risk, the fewer people and the less overcrowding in the prison system is certainly useful in reducing the risk of transmission.
Just to follow up on that, have we seen the Parklea outbreak spread to other prisons, specifically Bathurst?
No, so we haven't seen spread from Parklea to elsewhere. We know that there have been people released from Parklea and they are being closely followed up and tested to make sure that there's no risk to anyone else in the community from people who might have spent time in Parklea. In terms of Bathurst, we are aware separately of cases in the Bathurst Correctional Centre. There are 9 cases, all in staff members in Bathurst. So at a smaller scale to Parklea, starkly, but nonetheless concerning. And again, a lot of effort going in locally to make sure that staff and inmates in the Bathurst Correctional Centre are being tested, that infection control processes are in place, and that vaccination coverage is high.
Dr. Gale,
Your thoughts on those?
Sorry.
There are obviously a lot of people there that you wouldn't necessarily associate with protest movements as well.
Oh, look, it's always disappointing when people know the risks and they flagrantly disregard the risks, because it provides a setback to all of us. And I wish we could predict what the case numbers will do, but when people contribute by attending illegal super spreading events, that can be a setback for all of us. So I just ask people to know that we are going through the most critical months of learning to live with COVID. The light is there. We're nearly at 70% first dose. We'll be at 70% double dose before we know it in October, and reopening. So let's not spoil all of our opportunities to live as freely as possible, as quickly as possible. And I just ask people to respect everybody else. And I think in a healthy democracy, it's always right to demonstrate if you don't like something. We all cop it all the time about hearing different people's views, but please do it in a responsible way. Use means which aren't going to jeopardise your health or those of people around you.
Premier. Is there an update on the border arrangements with Queensland? Some of the hospitals there in the Tweed Heads area say that their staffing arrangements aren't sustainable.
Oh, look, unfortunately, I haven't received any different update from the Queensland government. They've not changed their position.
Can I just ask you about the Doherty modelling? The Doherty modelling says that in the first 6 months after we open up at 70%, there will be 385,000 cases nationally, and roughly that's about 150,000 cases in New South Wales. Are we prepared for an epidemic in the unvaccinated? Will unvaccinated people be under much stricter conditions than other people, like not going to work? Have you thought about that?
Well, yes, because all our plans are based on the Doherty report. Clearly, the whole point of high vaccination rates is to protect the community, because this is the epidemic of the unvaccinated. People who aren't vaccinated, and there's only a very small number that can't be, 99% of people are able to be vaccinated, and they should be, because we know that people will be exposed when they're not, and it does put pressure on our health system, and it puts pressure on the rest of us when people are unvaccinated. That's why we are literally having a call to arms. The Doherty report was very clear about that. So when you think about the case numbers we have today and the hundreds of thousands that are being quoted elsewhere, it puts into perspective that the case numbers don't matter as much. They don't matter at all, in fact, when you get to a certain level, because what matters the most is the high vaccination rate and the people that you're treating in hospital or keeping out of hospital. And in many places around the world, they now only measure the number of double vaccinated people who are ending up in hospital. So they've progressed. They're about 6 months ahead in their thinking. We've been shielded from all of that because we live in a continent, and we've been protected. We've had good quarantine rules, which haven't had us exposed to those high number of cases. And thank goodness, because we didn't have a vaccinated population. Delta has struck at a time when we're vaccinating our population, and so the strict conditions are to buy us time so we can vaccinate our population. But once we get to those higher dose rates, things will look very differently. The number of cases, I know I keep saying this, but I hope in 6 months' time people look back and go, okay, we didn't quite believe her at the time, but we understand now what she's going on about. It's my job to kind of think ahead. It's my job to have to make sure that we're preparing our citizens for the next conversations. And that's why I'm just asking everybody to come on the journey, engage in the conversation, because life is going to be very different in the months ahead.
Premier, if you are thinking ahead, then what are you projecting for the hospital system? Right now, the hospital rate is at 5.5. What are you projecting it will get to at its worst level, particularly thinking about those Doherty numbers, about the sheer number of cases we're going to have?
I'm actually expecting, I know that New South Wales Health is undertaking refresh work on that. I'm expecting data on that in the next week, and I'll be happy to share some of that data once I receive it. But obviously, day to day, you need a good set of data to be able to predict things into the future, and I am expecting some information in the next little while, which I'll be happy to share once I receive that.
Sorry.
Liz has an answer.
Weddings. On the weekend, there was an announcement that people would be able to get married this weekend coming, but the public health order hasn't been drafted yet, and people don't know what to plan. we've spoken to couples who live in separate LGAs of concern. Will they be able to get married this weekend?
That's what we announced, and that's the intention. I'll speak to Minister Hazzard and get updated information, but often the health orders only come out after all the legal work's been done, so I'll consult him. But if we've made an announcement about things happening from a certain date, the public can be assured that can happen.
Premier, can I ask you on another matter? Are you aware of Jodie McKay discussing the trade post with your government? I've got to try and ask the Deputy Premier as well.
I'm not aware.
Are you aware? Deputy Premier, can I ask you the same question? Have you had a discussion with Jodie McKay about her becoming the New South Wales government's trade envoy to India?
As the Trade Minister in New South Wales, I can say that we're always looking for candidates. We're going through a process at the moment. Those candidates could be anyone and everyone, and they're a mixed bag of candidates right across the board, and we'll have more to say about that. But they're confidential in those conversations. They're confidential in the nature of those conversations, and we'll have more to say. I think what you've read in the media is a view and what Jodie has said, but I'll leave it at that.
I've got an important question about borders, Premier.
Last question.
So on interstate borders, 2/3 of people, according to a poll in the Telegraph today, want borders to reopen, but only for vaccinated people once everyone has had the opportunity to get a vaccine. Only 30% of people want borders to open for everyone. Do you think that interstate borders should open for just the vaccinated when everyone has had the opportunity to get a vaccine?
Well, I think we get to a stage where you need to stick to the national plan. My preference, it's 70%. Well, that's why it's 70% double dose. Privileges and freedoms will extend to only those that are vaccinated. Now, at 80%, you will only be able to consider travelling internationally if you're vaccinated. But I say this, many airlines will make those decisions for us. Many airlines will say you can't jump on my plane unless you're vaccinated, and they will have every right to do so. So I say, irrespective of what government policy is at any stage, private organisations are entitled to have policies to keep other customers safe, to keep their workforce safe, and to prevent the spread of the disease. So don't assume it's only government policy that's relevant. It's also non-government, but business leaders will have a say on what they feel is the best way forward. And for a business community that's been absolutely smashed for the last 2 years, and in New South Wales even longer, if you add the drought, if you add the bushfires, if you add the floods, we're talking about 3 years where many businesses across the state have been smashed. The most important thing to you, understandably, will be business continuity, business certainty, not having to stop, open and shut, open and shut. And that's what the higher rates of vaccination assure us. Once you get to 80% double dose, there should not be any circumstance under which there will be a lockdown of any description. But that's also up to business who want certainty and business continuity to be able to say, well, it's up to us. We don't want to expose our customers or our workers. And airlines themselves around the world, some have and some haven't. Some airlines welcome people who aren't vaccinated, but most airlines are welcoming people who are fully vaccinated. Thanks, everybody.
Just on the Aussies overseas.
Sorry.
Liz.
I just wanted to ask, there's a pregnant woman who's in Newcastle ICU and she tried to get a vaccine and couldn't. Is there prioritisation for pregnant women and breastfeeding women to get vaccines? And also, can you give us an update on her? And
Thank you. Look, obviously very sad to hear about that particular case of that pregnant lady in ICU. I understand that she remains in ICU. I understand that she's not ventilated. In terms of access to Pfizer for pregnant women, all pregnant women are eligible to receive Pfizer, and the Commonwealth did update that, I think in July, so that all pregnant women are eligible and encouraged to get Pfizer. Clearly, we understand that some people who are pregnant may have struggled to get access to Pfizer vaccine. And for any pregnant women out there who are seeking to get access, I do encourage you to talk to your GP or talk to your obstetrician for assistance in accessing Pfizer. But certainly as vaccine supplies become more available, we would really want to see pregnant women getting access to that, and I know that in a number of antenatal settings across the state, efforts to increase access for pregnant women to Pfizer are actively underway. Thank
Premier,
you.
it's on the Aussies overseas, just one last one.
one.
You mentioned the thousands of Aussies wanting to come home. Is that a commitment that Aussies from New South Wales will be home for Christmas, and will they home quarantine?
Well, obviously, we need to get to that 80% double dose vaccination first to be able to consider international travel, but also welcoming home more Australians. And if they're double dose vaccinated, I think home quarantine is a definite. The traditional hotel quarantine system is no longer relevant when you have 80% of your population double vaccinated, and it's no longer relevant when the key issue is rates of vaccination. So things will look differently. And as I said, if other states aren't ready to welcome home Aussies at 80% double dose, New South Wales will be. And if means more citizens come through Sydney Airport, so be it. The more flights, the better. But obviously we're working through those issues and discussing them at National Cabinet and with the Prime Minister. Thanks, everybody.